My name is Dr. Sian Stanley. I'm a GP at Church Street Medical Centre in Bishop Stortford and the Clinical Director of Stort Valley in the Villages Primary Care Network. We set up a respiratory service here at Herts and Essex Hospital, really off the back of the COVID pandemic when we had a hot clinic here. And it evolved into what we term a respiratory hub, where we utilise our ARRS staff and a GP consultant to take patients who've got respiratory problems, children, adults, all ages, to come down here and have an examination if they needed to be seen face to face. So it was an evolvement really from our COVID hot clinic, and that we've now moved into a phase where we're now regularly seeing patients as a PCN, as a group of practices together, utilising the GP consultant model. We first funded the clinic through a transformation bid that came via the CCG, and we used that money to set up the operational side and also the GP consultant employment. And at that point we were just scoping out whether this was a sustainable service that would work. We found it very helpful, so we've now moved into a phase with the clinic where we're using IIF money to pay for our GP consultant, and it's self-funding in the sense that the ARS staff obviously come with full reimbursement, and the operational side of things has really sort of bedded in within the GP Federation and the primary care networks. The impact on practices has been variable depending on the practices involved. So for some of the practices that hasn't really had a huge impact on them because they're quite happy with the services they're offering in-house. For other practices such as my own, it's had a massive impact in terms of being able to triage patients either digitally or through the telephone, and then booking them directly in for face-to-face appointments in the afternoon slots. So different practices have reacted in different ways, and certainly from a Church Street perspective, geographically it's been very helpful because it's utilising one of our sites. So our patients are familiar with this site, they're perfectly happy. It's also introduced patients to the concept of seeing physicians associates, paramedics, advanced nurse practitioners, registrars as a matter of course. So they now accept that they are very much part of the primary care team, and that it's not always a GP that they're seeing, and that's been really helpful in introducing the roles into primary care.
So the hub has been a great opportunity for us to work together as a PCN, develop services together, but also to develop training together. It's been an excellent opportunity for our registrars, for our foundation doctors and our AHPs to learn together in a really safe environment. We have a GP consultant who's normally a trainer, and they supervise the doctors during their clinics. They're available if there's any questions. They can go in and review if there's any examinations or review of patients that needs to be done. And they're also a really good resource to help those doctors with their portfolios that's needed for their training. So this might be AHP roadmaps, or it might be a GP registrar's portfolio. And it's really good to have those GP trainers there, just to have another pair of eyes, another GP trainer to be able to support them.
Okay, so this really makes a difference to how I work with patients. It's another way that the primary care network can support all of the practices that are within its remit, providing extra appointments, face-to-face appointments for their patients, and then for myself it helps whilst I already work across all 5 sites. It's just additional time working and supporting their needs. For some of the benefits to myself and other staff members, it's the one place where the PCN staff, especially the R's roles like myself and the other PA, can come together working alongside each other while seeing different patients, but still able to discuss cases, look to each other for support each other with lists when you have a complex patient that maybe overruns and you're starting to run behind. Your colleagues can chip in, help you along. It's set up to be really supportive and engaging, and equally the consultant GP will also support you if you're struggling.
So the future of the hub is very much establishing a consistent pattern across the week for the working patterns of the GP consultant. It has been more difficult to recruit on some days than others, and to make sure that there's a consistency across the piece. But also to acknowledge that obviously in the winter months a respiratory hub is going to be a lot more busy with acute respiratory problems than in the summer months. And so what we're thinking of doing is adapting the model that in the summer we're looking more at long-term conditions, particularly around asthma, COPD, making sure that patients' health is optimised so that when they do go into the winter months, hopefully they'll be more well to be able to cope with the respiratory viruses that are going around.
So the difference that this will make to my career progression has already begun. So having never worked in primary care before a year ago, this gave me a really supportive learning environment with direct access to a consultant GP for queries, providing that level of supervision. Supportive learning has really aided my development as I've come into this role, and given me a lot more confidence when I'm now seeing patients in other practices as well. Moving forwards, this area of support and supervision will help when I'm doing my independent prescribing shortly, and then also moving on to doing my advanced care practitioner qualification. It's a guaranteed place where I've got direct supervision for signing off portfolios and pieces of work.
So it will be great to see our training hub develop further over the next few years in Stork Valley and Villages with this same day clinic that we've got. We are now a learning organisation which has opened new doors in terms of working and training together. But I think it's a real opportunity for us with our integrated neighbourhood team to work together, and as we develop new services to look at how we can include education in that. So with the same day clinic, including partners such as HCT, working with the in-hours visiting service, working with other providers so that we can have a more integrated way of working here, but also involving registrars, learners in the opportunities that brings to learn about different providers, different systems.